Welcome back. You're watching Newsbreak. India is seeing a third wave of COVID cases with an over 40% rise in daily cases in just the last 24 hours. India's reported over 90,000 coronavirus cases. A majority of spike is being seen in urban pockets across India's metropolitan cities. Kolkata, for instance, at the moment reporting a positivity rate of over 40%. So that's India's caseload and death tally in the last 24 hours. Are our existing contingency measures in place? Are they enough? Is Omicron indeed mild? What are doctors and experts saying across metros in India? Joining us is a panel of expert doctors. We have Dr. Anita Matthew, infectious disease specialist from the Fortis Hospital in Mumbai. We have Dr. Shamsher Dwivedi, he's the head of the COVID task force, Vimhans. We have Dr. Romel Tikku, Director, Internal Medicine, Max Super Speciality Hospital, also joining us from Delhi. We have Dr. Ravindra Mehta, Chief of Pulmonology and Critical Care, Apollo Hospitals, Bengaluru. Dr. Sushmita Roy Chaudhary, Director, Pulmonology, Fortis Hospitals, Kolkata. Thank you, doctors, very much for joining us on NDTV. Dr. Sushmita, I want to begin by asking you, worrying surge in COVID-19 cases in West Bengal, Kolkata particularly bad, with people tweeting about how it's taking more than 48 hours for COVID reports to come. The positivity rate has worryingly crossed 40%.
Yes, it's pretty bad. We've been through 2 waves already, and the third one, there isn't anybody around that you don't meet who doesn't have somebody who has a body ache and a sore throat and fever, a feverish feeling. And as you know, the health services, the diagnostic services are having to bear the toll of such high numbers. So at the moment, I think anybody who has these symptoms, unless proved otherwise, has the virus. So I think, the best way forward is for them to isolate themselves till the results are back. But it is definitely very difficult. Emergency services are really overloaded, and a lot of our doctor colleagues, are actually falling to it because of the sheer number of patients we are having to see in the hospitals.
Right.
Not that they are particularly very sick.
But Dr. Sushmita, how worried are you about the fact that RT-PCR tests aren't easily available? Reports are taking more than 48 hours to come because, a lot of these patients could be carriers and therefore could, potentially infect other people.
Well, yes. But having gone through 2 waves, I think it should be pretty clear to most people by now, and I'm still very surprised that most people are still behaving irresponsibly, that if you do have viral symptoms, then the first thing to do is isolate yourself, wear a mask. That alone is going to be good enough not to transmit any infection. It doesn't really depend on your RT-PCR to give you a diagnosis of a viral infection in these days. And that is what we do when the patients, kind of turn up at our emergency. Ask them to isolate because they have mild symptoms of a bad viral infection, if you like. And the best thing that they can do while waiting for their RT-PCR is to isolate themselves and not go about, without a mask and keep infecting other people. But it's definitely worrying that common sense is definitely at the moment much desirable.
I think it's really important that you say that, Dr. Sushmita, because it's important for our viewers to hear this. If you're waiting a test, you don't have access to a test, your report is delayed for whatever reason, you must just wear a mask and isolate. Presume that you are COVID positive unless you have a negative RT-PCR report. Dr. Mehta, if I can come to you at the moment, the big worry in Karnataka continues to remain the doubling rate of cases. We spoke with the Health Commissioner of Bengaluru today, who said that there's already provisions being made to reserve 50%, 75% hospital beds, especially in the urban pockets. What are you seeing as far as Karnataka and Bengaluru is concerned?
So we are seeing what we actually expected to happen, that once the Omicron run starts, it's going to be like a gallop, not a run itself. So we're seeing a remarkable rise in cases, only limited by the testing. I think if the testing was more profound or people could test more, we would see even a larger number. So we're seeing a huge number of cases. The authorities have swung into action. The remarkable part is 1 day to 30% and 24 hours they want a 50% reservation. So all the lessons of the prior 2 waves are being looked at carefully, and they are now pounding it in straight that they want healthcare to be ready. So far, the saving grace is that we don't have the hospitalizations as much as maybe some of these other states, as Sushmita was saying. We're still okay. But then it all depends on the tipping point. The tipping point is when the numbers overwhelmingly increase to a point that healthcare can't manage, and that, in a nutshell, is everybody's concern.
Right. Dr. Romel Tikku, if I can come to you at the moment, the big worry is the burden on the healthcare infrastructure. We're all too familiar with what we saw in the second wave of COVID, with so many people dying in the second wave, not because of the virus, but because of lack of medical care. How are you looking at the current numbers? Delhi on a daily basis, for instance, is seeing an almost 40% day-on-day spike. We're seeing 15,000 cases being reported in just the last 24 hours. The positivity rate is already at 15%.
Well, this is something to worry about, the exponential increase in the numbers in Delhi. See, we always knew this was coming. If it was happening to the rest of the countries in the world, UK, US, Europe, we were just lagging behind them by 1.5 months. And the fact that healthcare workers are falling sick is another challenge for us. And who's going to take care of the patients? And we always dismiss it off that it's a mild variant. That's the biggest mistake we are doing. All these variants have the potential to cause severe disease and death. And we are seeing that in US, we're seeing that in UK also. So please don't dismiss it off as a mild variant. And the fact that increasingly people are getting infected will ultimately burden the healthcare system. There's a huge potential for this variant to burden the healthcare system, and I'm afraid we might be heading towards that. We might need more restrictions in place, and people also have to be more responsible. As the doctor on the panel said, please wear a mask, don't wear a cloth mask. The cloth mask doesn't give you enough protection. The government is doing what is needed, and we also need to ramp up the infrastructure, create more facilities. We don't want to go through what we went through in the second wave.
Right.
And the ones who are not vaccinated, please go for your vaccination.
Right. Speaking of vaccinations, of course, booster doses will be available for healthcare frontline workers. Starting Monday, the vulnerable population will also be given boosters. Immunity, however, after the boosters will still take another fortnight to kick in. Dr. Anita Matthew, if I can come to you at the moment, Mumbai has we don't have the latest 24-hour figures just yet, but yesterday's figures show that Mumbai has already seen the biggest spike that it's ever recorded. Just the city of Mumbai seeing the biggest spike it's ever recorded since the beginning of the pandemic. Are you worried that the existing contingency measures, the existing plan of action, night curfews, weekend lockdowns might not be enough?
Certainly it will not be enough, because night curfews, for that matter, probably is not going to really solve much of a problem if you curfew people between 10 and 5 a.m. in the morning. What I think is more required is to have pretty much a lot of curbs in place. I'm not saying you need to go in for a lockdown, because that's not really going to be viable anymore, and it's not really shown to have a major beneficial effect. It did have, though, in its first wave. But what we should probably do is to have some restrictions in place, like the schools and colleges should be completely shut. We have it for a particular age group which is still on. I think we need to do that. Staggering the office hours is something that we really need to look into. And the basic protocols and being a little more stringent, and people also taking their own responsibility to see that they are really behaving appropriately when you have a pandemic in place. Not all the onus can be placed on the government or the
Right.
machinery there.
Right.
There has to be some amount of onus from the people of the country, the citizens of our country. We all have to put in together our efforts to be able to contain this. Otherwise, we already are seeing an exponential rise. As all my other colleagues have already mentioned, our healthcare system is completely getting overwhelmed. It's just a matter of time before we really land up with a lot of problems.
And interestingly, one of the defining and very unfortunate features is that the healthcare system, at least so far, is not overwhelmed by a huge spike in hospital admissions, but the healthcare system is overwhelmed because so many healthcare and frontline workers are contracting this virus. So therefore, the capacity of the healthcare system in a certain sense at the moment is diminished. Dr. Shamsher, are more restrictions imminent? In Delhi, for instance, we had the health minister today again come out and say that even though cases are expected to rise exponentially, so far cases are mild, there is enough hospital bed capacity. Do you think that this will change, and it will change very quickly?
I think that as far as the restrictions are concerned, the only purpose that a partial lockdown or a lockdown serves is to stagger the numbers. The total numbers would remain the same. It is just that the staggering would happen so that the hospital is not inundated with patient and the infrastructure doesn't collapse. That is the only purpose of these restrictions, because at the end of the day, certain percentage of patients are bound to get infected for the herd immunity to pick up and the pandemic to abate. Now, coming to that mild thing, I feel that most of the political leaders, they are emphasizing that it is mild, it is mild, it is mild. That is making the people complacent.
Right.
It's like any other sardi zukham. It's like cough and cold. That is where they are going wrong. They should not underplay it. By reducing anxiety, there are other ways to give a statement to reduce the anxiety. But underplaying the infection is not good factually also, because it is a super spreader. So instead of 100 patients which got infected in the last pandemic, maybe 1,000 would get affected in a particular geographical location. I'm just giving a hypothetical example.
Yes.
So if in first wave with the Delta strain, if 21% or 20% needed ICU care, and Omicron requires maybe 4%, but it is super spreader, that 4% of the larger number will also be quite significant.
Right.
Other problem, the second wave was all about oxygen. This wave will be all about manpower. In Vimhans, we are already finding it difficult to man the system because many of our staff, right from consultant to nursing staff, have taken ill. Third important thing, many of the patients who are coming for other problems like stroke or any other medical disease, they are not having any respiratory symptom, no fever. We do a screening and we find that the patient is positive. So there are asymptomatic patients who are again helping in spreading the disease. And since it is a super spreader, right in the first week of the third wave, many of our staff are already sick. So one has to take all this concern and not underplay. I will again request through your channel to all the politicians, please do not say it is mild.
Well, I think that's a very important point that you raise, because what we've heard so far, the messaging that is coming in so far is that Omicron is mild, hospitalizations continue to remain low. The Delhi Health Minister today also saying that we have enough bed capacity. But I think you raise a very important point, Dr. Dwivedi. Dr. Tikku, do you want to come in here? Do you agree that the messaging perhaps needs to be different? The perception that Omicron is mild has almost led to people taking it less seriously. But what Dr. Shamsher says is very interesting, because he says that if 4% of 4 lakh, versus say 20% of 2 lakh, I mean, you're still extrapolate that data, you're still going to see those many more hospital admissions and therefore a burden on the healthcare infrastructure.
Yes, I agree with Dr. Dwivedi. That's what I was saying. We can't dismiss it off as a mild variant. And given the kind of population that India has, even a small fraction of the infected people, if they have severe disease, a lot of them will end up getting hospitalized, and that will overburden the system. And we don't have that kind of infrastructure if you compare with US, UK.
Right. Dr. Sushmita, if I can bring you back into the conversation, what are you seeing on the ground? Is the disease largely mild, especially in those who are fully vaccinated? Are the symptoms, perhaps, milder, and therefore more asymptomatic carriers are spreading the virus without realizing that they are COVID positive?
Well, there aren't that many asymptomatics around. Most people are having, the overriding symptoms that we are seeing this time around is a sore throat, a headache, and a body ache, which is usual viral symptoms that you would see. And a lot of them are complaining of a severe tiredness. Cough and shortness of breath are not there, but quite a significant amount of these people are actually turning up to outpatients and flu clinics for some sort of support. Asymptomatics, we are not seeing that many. Most people are symptomatic, but as you said, the unvaccinated ones are definitely the ones that we are seeing are requiring hospital admission. Oxygen requirement this time, interestingly, is much, much lower, as is intensive care requirement.
That's interesting. Dr. Mehta, do you want to come in here as a pulmonologist yourself and as someone who understands the critical care space? Can we assume at the moment that the lung involvement with the new variant may perhaps be lower than what we saw with Delta?
So that's what we're borrowing from the Western world and the South African experience. They've given us very encouraging statistics and proactively they're actually published in the best journals in the world to tell us that it's roughly 1/5 to 1/6 of what Delta was. So that is the good news. The unfortunate part is the good news is extrapolated to complacency. Yeah. We are forgetting that South Africa is 6 crores. We are seeing the onslaught in the US where 1 million cases per day with 100,000 hospitalizations is bringing the biggest country to its knees. Now we're talking a massive country like ours, where I think the metros are the hub and what will be our situation. So I think much as this mild message has come through as a feel safe and feel good message, the writing on the wall is the largest numbers is what we have. We are not in a situation to prevent stuff. I think we're seeing what's called the New Year fun consequence right now. Asymptomatics are a dime a dozen. We're just not catching them. They only get caught when they come for this travel business or they come into hospitals. So we have our work cut out for us. It's time to raise the alarms to the highest flag possible.
So it's time to raise the alarm. I think you're saying that in no uncertain terms. Dr. Anita Matthew, if I can bring you in as well, we're just getting breaking updates at the moment from Mumbai, where Dharavi has reported the highest ever COVID cases in a day, 107 COVID cases being reported in Dharavi. How are you looking at this?
Unfortunately, in Mumbai, we have a lot of other logistic difficulties. One of them is our slums are one of the biggest that we have in probably in Asia. So this kind of a situation, we would land up having a rapid spread of infection, which already Omicron is known to cause a very, very high rate of transmissibility. And this is not going to really help us at all. We are already, at a particular peak, and we all know that we are going to land up with in the next coming days with a very high number of patients turning positive, because Mumbai has been in the forefront even in the last 2 spikes. We have had a huge number of spikes in the last 2 occasions, and we are expecting something similar to that. And we really don't have the kind of infrastructure to manage this whole caseload. It would be, as I said, it's going to be a major burden, and we have a huge number of population that we are looking and catering to. They will not be able to afford these private hospitals, and government hospitals are going to get overwhelmed in a matter of couple of days.
I'll give the last word to you, Dr. Dwivedi, because I think, you echoed the same concern as well, that the burden on the healthcare infrastructure is going to come sooner rather than later, healthcare workers themselves testing positive. My last point, therefore, is, do you think India has perhaps delayed the rollout of boosters for our frontline healthcare workers, given the situation that we're seeing, especially in metros, where several hospitals, private and government, reporting a large number of healthcare frontline workers infected?
I would suggest that maybe if it was done a few weeks earlier, it would have been, I think, a good idea. But given the fact that the eligible population has not received both the shots, I think supply might have been one of the constraints because of which this delay might have taken place, because a huge population where have to give 2 jabs and many of them have not received the second jab. So I think that must have been playing on the mind of the health planners, and that might have delayed. So I don't, but yeah, maybe if it was few weeks earlier, maybe we would have been better prepared.
All right. So 2 weeks too late are we when it comes to the booster dose. Nonetheless, from the 10th of January, all our doctors, frontline healthcare workers and vulnerable population will be eligible for the booster. But as we know, it does take at least a fortnight for vaccine-induced immunity to actually kick in. So one sincerely hopes.
Rishika, one point.
Yes.
One point. Fortunately, since we have already received 2 jabs, the 3rd jab will act faster.
Okay.
Because body is already, immune system is already primed. So this time, those who have already received 2 jabs, their immune system will kick in faster with the booster dose.
All right. Well, that's good news then. Thank you, doctors, very much.